This presentation looks at CVS Health through the business model canvas and then moves into a business model innovation prototype. I'm staying with CVS because we've already analyzed the company's strategy, structure, and leadership across the earlier modules. For this assignment, the question is a little different. It's not just what does CVS do, it's how CVS creates value, how the business model could be redesigned for the AI era. The prototype I'm pitching is CVS Care Navigator, which is an AI supported but human backed navigation layer that helps connect benefits, pharmacy, and care services in a way that feels less fragmented for the member. So, the first part is the business model canvas. So, I'll walk through the current CVS model and how the 9 blocks work together. Then I apply one innovation pattern, which is a multi-sided platform. After that, I use 2 what-if scenarios and choose one to build into a prototype. Lastly is the reflection and strategic leadership, because this assignment isn't just looking for a creative idea, it's asking whether a leader could actually use the model and keep improving it. So the first section is the business model blueprint. The business model canvas is useful because it does not treat the company as one big paragraph. It breaks the model into the pieces that create, deliver, and capture value. For CVS, that matters because CVS is not just a pharmacy. It has pharmacy operations, Aetna, Caremark, care delivery assets, digital tools, and customer relationships that all have to connect. This is the current CVS Health business model canvas. The main thing I noticed is that CVS is not a single product company. It serves several groups at the same time: patients, Aetna members, employers, government payers, and pharmacy or provider clients. Its value proposition is about convenience, medication access, insurance coverage, and care support. The model depends on major resources like CVS Pharmacy, Aetna, CVS Caremark, digital platforms, and health data. So the value is not just in one store or one service, it's in whether all of these pieces work together in a way customers can actually understand and use. On the customer-facing side, CVS is working with more than one audience. A regular customer may think of CVS as a pharmacy, but the model is bigger than that. CVS also serves Aetna members, employers, government payers, and pharmacy-related clients. The value proposition is supposed to be convenience and connection. That means helping people access prescriptions, understand benefits, manage care, and use local or digital channels. The issue is that healthcare still feels confusing for a lot of people. So even though CVS has the pieces, the customer only feels the value if the experience is easy to navigate. The operating side shows how CVS captures value. CVS has a lot of expensive and complicated resources, including stores, technology, claims data, health plan assets, and care teams. Its key activities are also spread across pharmacy, benefits management, insurance, and care coordination. This is why the model has strategic potential, but it is also why it can become messy. The more pieces CVS adds, the more important coordination becomes. The business model only works if CVS can turn those resources into a smoother experience instead of more complexity. The innovation pattern I chose is the multi-sided platform. I chose that because CVS is not just serving one customer group. Its model only gets stronger when several groups get value from the same connected system. The pattern I'm applying is a multi-sided platform. A multi-sided platform creates value by connecting different groups that need each other. For CVS, the groups are members or patients, employers and plan sponsors, pharmacists and clinicians, and CVS's own business units. The reason this fits CVS is that CVS already has different sides of healthcare under one company. The gap is that the customer experience can still feel fragmented. CVS Care Navigator would make the platform more accessible and easier to use. It would help members understand what to do next, help employers get better engagement, and help care teams step in when a human is needed. The platform pattern changes the model in three ways. First, it improves the value proposition. CVS would not just be saying we have pharmacies, insurance, and clinics. It would be saying we can help you understand the next step in your healthcare journey. Second, it changes the revenue logic. I would not charge patients a separate fee just to get help navigating a complicated system. The cleaner approach is to tie the model to employer clients and plan sponsors because they have a reason to support better member engagement. Third, it expands the customer relationship. CVS will be building an ongoing navigation relationship, not just handling one transaction at a time. For the AI augmented part, I use ChatGPT to generate and compare two what if scenarios. I'm using the stronger one as the prototype because it fits CVS existing strategy better and does not depend on customers paying more out of their pockets. The two what if scenarios are both realistic for CVS, but they do different things. The first asks, what if CVS gave Aetna members one connected navigation experience instead of making people bounce between pharmacy benefits, clinic, and care support? That is the scenario I chose because it goes straight to the customer problem. The second scenario is more about revenue. It asks what if CVS sold the model to employer clients with some performance measures tied to engagement and affordability. I think that could work later, but the first prototype is stronger because the business model should start by creating clearer customer value. This is the revised prototype canvas. CVS Care Navigator would not replace CVS's existing model. It would sit across the model and make the pieces easier to use. The customer segment is mainly Aetna members and patients who are trying to manage prescriptions, benefits, and care decisions. The value proposition is one front door for benefits, prescriptions, lower cost options, and care routing. The key activities are consent-based data connection, AI-supported triage, human escalation, and outcome tracking. The key resources are CVS's existing pharmacy footprint, Aetna and Caremark data, care teams, and responsible AI governance. The important part is that AI is not the final authority. It supports navigation, but human support stays in the model for judgment, trust, and sensitive situations. If I were pitching this to CVS leadership, I would say the problem is not that CVS lacks assets. The problem is that a regular person using healthcare may still feel like the system is scattered. CVS Care Navigator creates new value by simplifying the member experience. Instead of making people guess whether to call insurance, ask the pharmacist, use the app, or find a provider, the Navigator gives them a clearer next step. It also uses assets CVS already has, like Aetna, Caremark pharmacies, clinics, digital channels, and care teams. Finally, the model can be tested with measurable outcomes. CVS could track engagement, lower cost medication navigation, human escalations, and member satisfaction. So this is not just a technology idea, it is a business model improvement built around strategic fit. So the last section connects the creative part of the assignment back to strategy and leadership. A business model innovation is only useful if leaders can test it, manage the risk, and bring people with them. AI helped me most with organizing the business model canvas and thinking through possible what-if scenarios. It was useful because CVS is a complicated company and it can be hard to explain the model without getting lost in every division. But AI did not decide the strategy. I still had to choose which idea made sense, which pattern fit CVS, and what sounded realistic. The biggest lesson for me is that innovation is not just coming up with a new feature. It has to fit the company's resources, the customer problem, the revenue logic, and the risk. In healthcare, practicality matters even more because the model has to protect trust, privacy, and human judgment. A strategic leader would not look at this prototype as just another app. The real leadership issue is how to turn it into a controlled learning system. The first trait is vision. Leadership has to make it clear that CVS is trying to make healthcare easier to navigate, not just add digital tools. The second trait is adaptability. CVS should pilot the model, measure results, and adjust before scaling. The third is risk management and ethical judgment. AI in healthcare has to have consent, privacy, bias checks, and human escalation built in from the beginning. And the fourth is culture. Aetna, Caremark, pharmacy, clinics, and care teams have to be aligned around the same member journey. If each unit protects its own lane, the model will not work. They have to work together. The mechanism I would recommend is a pilot, measure, review, iterate, and scale process. First, CVS could pilot Care Navigator with one member group or one employer client. Then leadership should measure actual behavior, like whether people use it, whether they get to the right support, and whether they feel more confident navigating care. Third, there should be governance review, especially around privacy, bias, and unintended effects. Fourth, the model should change based on real use, not just assumptions. Finally, CVS should scale only after the model proves value and trust. This is how leadership can balance data-driven innovation with culture and stakeholder alignment. AI was used to organize the canvas, generate what-if scenarios, compare prototype options, and help structure the slides and speaker notes. The final analysis still needed human review. I selected the sources, checked the claims, and decided which strategy fits CVS. I also made sure the prototype stayed realistic and did not ignore healthcare ethics, privacy, or human oversight.